Hi, I'm Dr. Greg Grillo with Express Dentist. I've been practicing dentistry for 27 years, and I get asked a lot of questions like, what is a root canal? Can you tell me more about it? Teeth are pretty complex. You have the hard outer layer that we can see, and on the inside, we have a canal system. It starts with a pulp chamber right in the center of the tooth. It's like a little cave, and it's connected by little tunnelways that are the canals. Those connect down into the jawbone through the roots of the teeth. And inside that is the soft part of the tooth. That's the nerve tissue and the blood vessels. The blood vessels provide nutrients to the inside of a tooth, and the nerve system serves as a warning system. So if we get pain or discomfort, it's telling us that something may not be right. Anything from cold sensitivity to a throbbing toothache and everything in between means that something needs to be evaluated. So if that warning is coming through, it's a very good idea to have the tooth evaluated to find out exactly what's going on and what the options are. So one of the options may be a root canal. So even though the root canal refers to that internal system, most people think about a root canal as a treatment. And root canal treatment is the systematic cleaning, disinfecting, and sealing of that internal tissue, removing it and then sealing up the tunnels and the chamber that we mentioned earlier. So a root canal is performed to eliminate pain and infection and inflamed tissue. And it often serves as an alternative to removing a tooth. So if a tooth is infected or inflamed, something needs to be done. And generally the option is remove the tooth or perform a root canal and save the tooth. So you'll know that a root canal needs to be done possibly if you have symptoms, but not every symptom is associated with the need for tooth removal or a root canal. So it's very important that if you're having some symptoms, a warning, that you get it evaluated. And you may find that it's something much simpler than those treatments. But with a good digital x-ray generally and an evaluation with some simple tests, your dentist can help you determine just really what are the best options for you. And if it's decided that a root canal makes sense and that's what you choose, then the dentist would numb the tooth, and today's anesthetics are very good at doing that. And then usually a small shield known as a rubber dam is put around the tooth. And then a very small access hole is made through the chewing surface of the tooth. That small hole allows your dentist to place very fine, small instruments down into those canals that we mentioned and clean them out, shape them, disinfect them, and seal them. Once all of that is done, either a small filling is put in that little hole, or in many cases with back teeth especially, you may have a cap or a crown. They are the same thing, a cap or a crown that is put over and around the tooth. So it's glued to the tooth and it provides a tremendous amount of strength and returns the tooth very close to its original natural strength. So many people are often concerned about, aren't root canals uncomfortable? They have had that reputation historically, but today's root canals are done with some of the best anesthetics we've ever had, and they're often done in just one visit. And that makes a big difference because all of the treatment is completed in that single sitting and allows the tooth to start healing very, very quickly. So in most cases, it doesn't take more than a single visit to have a root canal done. And once it's done, it's meant to be a lifetime solution if the tooth is taken care of with good oral home care and good habits. But the research shows us that root canals tend to be about 95% successful in many cases. And the outlook for your tooth should be discussed with your dentist to see if there's any special factors that might affect that longevity. So there are very few side effects with root canal. Most commonly would be maybe a little bit of soreness in the area. You may avoid chewing on it for a few days as everything heals and settles back down. And your dentist may put you on an antibiotic or some over-the-counter medications just to help control that until it's back to normal. So obviously it's an advantage to have a root canal done if it's indicated and you so choose that option. It's an advantage because you get to save your own tooth. And in most cases, there's nothing like having your own tooth, and then you don't have to look at replacement options or some of the other complications that happen when there's a missing space and teeth start to shift and move. People are often concerned about how much a root canal costs, and that's going to vary a little bit depending on the part of the country you're in. And more importantly, it's going to depend on how complex the treatment is. So front teeth tend to have a single canal in them right down the middle, and back teeth may have 3 or 4 canals and be fairly complex to take care of. So it could cost anywhere from, let's say, $500 to $1,500 as a range. Now, if you have dental benefits, they're often going to help with that total cost, and every plan is different. But you also do need to consider the cost of the filling that goes in the top of the tooth or the cap or the crown that needs to be done. And the dental benefits may help with that as well. So if you're having any type of a warning, if there's anything from sensitivity to bite pain that's sharp or dull, or you're just having a throbby toothache, and certainly if you have swelling anywhere in your face or jaw, that can be pretty serious. And regardless, it's all part of that warning system. So you do want to see a dentist and at least get it evaluated. It doesn't mean that you'll need a root canal or that you'll lose a tooth. It may be something much simpler than that. So the key is to get in and find out what is going on, and then know what your options are and be able to make a good informed decision. At Express Dentist, we have a network of vetted dentists that are known for quality care all across the country. So if you need help in finding a dentist, please reach out. Thank you, and all the best to you.